epidemiological situations, and state leaders are in the best position to take our general national recommendations and translate them into more precise guidance for their state and its conditions. As we approach the vaccine rollout, we're also continuing to expand access to treatments for COVID-19. As of this week, we've distributed more than 157,000 patient courses of 2 authorized antibody products across the United States and allocated a total of 205,000 courses for delivery to states. More than 3,000 sites are currently signed up to offer these treatments. We've also launched a pilot program that will explore how to reach vulnerable populations with these treatments and offer the treatments in even more convenient locations. As we mentioned, Americans need to know that this treatment is a possible option for patients who are at high risk for severe COVID-19, but who have not been hospitalized. That includes all Americans over the age of 65. That's the definition we're using in this case for risk of severe COVID-19. Receiving this treatment, if you're in that category, could help keep you out of the hospital, potentially helping to save your life. So we want to encourage the news media and all Americans to spread the word about the availability of COVID-19 treatments. And we want to encourage Americans to start playing the role that they'll have in an eventual vaccine, too. Vaccines will only bring this pandemic to an end if enough Americans choose to take these vaccines. We now have highly promising efficacy data that I believe many Americans are encouraged by and excited about. But I want to encourage Americans to get prepared and to get educated now. Visit the CDC's website to find out more about the vaccines we're developing and the process they've gone through. If you have questions now or have questions further down the road, talk to your healthcare provider about the importance that safe and effective vaccines have to our own health and the health of our communities. These vaccine products will be assessed with the same rigor that Americans can expect when it comes to any other vaccine or drug that is reviewed by the FDA. As each one of us here has said, we're excited to take this vaccine, and we will encourage our family and friends to do so.
The final analysis has now been completed with 94.1 efficacy against moderate and severe disease. Importantly, there were 30 cases of severe disease in the trial, all 30 in the placebo group, so 100% efficacy. There were 7,500 and some elderly people with age over 65, and efficacy in that population against moderate disease was 87.1%, and efficacy against severe disease was also at 100% since there were no cases in the vaccine group. I think those are very important data to keep in mind. This exceptionally good data, and in fact, remarkably similar to the data that you have already seen coming from with the Pfizer vaccine. And obviously, as the Secretary said, the fact that an external regulatory agency of the highest caliber and standards, equivalent to those of the FDA, the UK MHRA, has approved the Pfizer vaccine. Of course, they have not been part and involved in any of the politicization that surrounded the development of this vaccine. And I hope this will be another evidence for the American population that the data with these vaccines are clear, are transparent, and demonstrate that they are effective and safe for use in the general population. Because as the Secretary said, vaccines are useless if they are not used to vaccinate people. I think also really great progress with two other vaccines in the pipeline. The Johnson & Johnson vaccine, which is a recombinant human adenovirus 26 vector, has now recruited a little bit more than 28,000 subjects in the phase 3 trial. Now, the breakthrough that we hope with this vaccine is that it's a one-shot vaccine with very fast efficacy achieved and 100% compliance, so to speak, since everybody who gets one shot get the full vaccination schedule. It will be very important, by the way, for all Americans who get the Moderna or the Pfizer vaccine to have their first vaccine dose and then come back either 3 or 4 weeks later to get their second vaccine dose to complete the immunization schedule. The next vaccine in the line is the AstraZeneca chimpanzee adenovirus live vector vaccine. The phase 3 trial that's conducted here in the US under the Operation Warp Speed oversight. So it's a different trial than the UK, Brazil trials that have been communicated about last week. Is progressing very well. We have about 15,000 subjects recruited in the trial. Both the Janssen trial and Johnson & Johnson and the AstraZeneca trial are likely to complete their efficacy requirement, which is the number of cases accruing in the study, somewhere between very late in December and the middle of January, given, unfortunately, that the pandemic is extremely active and there is a lot of transmission in the population. In closing, on the side of vaccine, just like to remind you that fortunately the investments we have made in scaling up and starting to stockpile manufacturing of the vaccines allow us to feel confident that we will be able to distribute 20 million, enough vaccine to immunize 20 million people in the US in December. That's 40 million doses. Then 30 million people, 60 million doses in January, and 50 million people, or 100 million doses in March. So between December, mid-December, and in February, and end of February, we will have potentially immunized 100 million people, which is really more or less the size of the significant at-risk population, the elderly, the healthcare workers, the first-line workers, people with comorbidity. I'll close there. Of course, be happy to answer your questions later on and pass on to General Perna.
Great. Thanks, Dr. Salawi. As always, incredibly well informative for us. All right, so team, today I just want to talk quickly about 3 things. Allocation update, our distribution in support of the state plans, our ability to empower them to execute their plans. And then third, just to reinforce the challenge, my word, to Secretary Azar's comments at the end about learning about vaccines. So, first reference allocations. We have provided the 64 jurisdictions, which a reminder is the 50 states, 8 territories, and 6 megacities, as well as 5 federal agencies with their allocations of the vaccines that are going to be available in the month of December. What we've done is we believe for planning purposes only, we had to pick a date, and I've coined the phrase snap the chalk line so that we could plan on actual doses that will be available. So, for example, a week and a half ago, or on 20 November, through Tiberius, we provided the 64 jurisdictions and 5 federal agencies their allocations for the Pfizer vaccine of a total of 6.4 million doses that will be available. A week later, on 27 November, we provided the 64 allocation jurisdictions and 5 federal agencies their allocations for the Moderna vaccine at 12.5 million doses that will be available. Again, we are planning to be ready when EUA is approved. It is not about getting in front of EUA. It's just making sure that we have everything locked. So when EUA decision comes, distribution to the American people becomes immediate within 24 hours. That's our goal. That's what we're striving for. And that's what we're working to. You can't execute if you don't have a plan. And that's what our emphasis is as we work through all that process. We are going to send half the doses based on allocations to the jurisdictions and agencies because it is a 2-dose regimen, as Dr. Salawi just talked about. So half of the allocation will be sent out, and then 21 days later for Pfizer and 28 days later for Moderna, we send out the second half of allocations. 2 reasons. One, to ensure that we don't over-administer and that we have the second dose on hand. And second reason is to make sure that we don't overwhelm limited storage capability and capacity at the state level. We want to augment their plans, enable their plans, not constrain them from the greatest distribution capability that they have. We utilize a Tiberius platform that we developed, right, which is a capability that takes in all the informative data from the states, hospitals, doctors' offices, pharmacies, only on the specification of vaccine as it is delivered and vaccine as it is administered, so that we can maintain the flow of vaccine to the American people. As I've talked about, our goal is to distribute within 24 hours after EUA and the first pushes. Then we want to maintain a cadence, a deliberate, planned, coordinated cadence of delivery of vaccine as it becomes available. The only way you can do that is if you see yourselves. And we have to see ourselves from point of administration all the way back to point of fill finish. And in doing so, then we can coordinate, collaborate, plan together the distribution of vaccines down to the states. We have requested that the states lock in their micro plans for final distribution of both vaccines. So, for example, this week, we've asked the states in total jurisdictions to have their micro plans in Tiberius by the end of the week or for December. This way, we can ensure that we understand all the places where they want the vaccine delivered and at what quantities they want the vaccine delivered. And then we can coordinate with Pfizer to ensure those boxes are prepared and ready to be distributed upon EUA. Addresses in the system, coordination with McKesson, the master distributor, through FedEx, UPS, and then down to the administration sites. Really a key effort by everybody. We've asked for the states and jurisdictions to have their micro plans ready for the Moderna vaccine by the 11th of December, which allows them to do the same planning. And in theory, what happens is the vaccine comes in to where they want. It enables their plan for immediate administration of the vaccine to the priorities that their governor establishes at each state. Here's the key. The states know their people, their populations the best. And as they follow through with EUA, eventual EUA guidance and the ACIP guidance that was put out yesterday, then you have leaders taking responsibility and directing a priority of vaccine into administration or shots in arms. Our responsibility is to enable their plan to empower their plan. And that's why we've asked for the micro planning and the detailed work to happen accordingly. After the initial pushes go out for Pfizer and Moderna, then every week, right, based on availability of vaccine, as Dr. Salawi alluded to, 40 million total doses in December, and then January, February, March, we are going to push allocations as vaccine becomes available. We are not waiting for a cluster of vaccine to be available and then push. We want to have this rhythmic, cadenced delivery of vaccine so the states can best manage it to the priorities as they've developed it. We visualize each week additional vaccines getting out, and eventually we just continue to build on the amount of people that get vaccinated, and hence on our way to ending this pandemic. Jurisdictions and the governors, quite frankly, will decide where they want it to go at the end of the day, and we're enabling to that end. So I just would reinforce in this point here, allocations made, jurisdictions planning. We're trying to enable them to work through their priorities to best take care of the people of their jurisdictions accordingly. Second, I'd like to talk to you about how we are working to empower the states and make sure that they are well informed of all the processes that we have available. I just want to commend the CDC for the remarkable work that they are doing. These great leaders, these very, very talented professionals, well-trained experts in this field of distribution, have really set up an elaborate coordination and collaboration effort with the states. They run daily, weekly meetings. They work through detailed execution of plans. They make recommendations on how to best facilitate and operationalize the distribution. And then they figure out ways to enable the state and jurisdiction plans. Really well done by the CDC, and I'm pretty proud to be a part of the collaboration with them. Second, we've worked a very elaborate update in talking to the governors, either through HHS or up through Vice President Pence's sessions with them, but also through individual phone calls to the governors, to their health coordinators, at the senior leadership level, to make sure we're answering questions in a timely manner and getting them solutions to their problems. Again, we want to enable and empower the jurisdictions to execute their plans. That is our sole goal, our responsibility to do, and we've worked extremely hard. Two things I've coached people on: over communication is an asset to our execution. And then second, you got to do the virtual circulation, right? We have to see what the governors and their staffs are seeing so we can best enable them. Clearly, one of their concerns that they're working through is how to do nursing homes, long-term health care facilities, right? And the CDC and OWS collaborated, really worked a very extensive plan in collaboration with CVS, Walgreens, and other private pharmacies to enable state governor plans on getting to those facilities. How do we get it out to them? How do we make sure that we're there to administer to them? And I am incredibly confident that these private-public partnerships are ready to execute based on the governor's priorities and plans to do so. And I am excited to watch that to get operationalized. The last thing I'll leave you with, in touching with Secretary Azar's comments and reinforcing Dr. Salawi's comments on really the great potential and efficacy of the vaccine, is as we go forward, vaccine is only good as it being administered to the American people. And so I just ask everybody to really educate yourself, right? Figure out, what you want to do as an individual, but be informed in your process. Don't allow one headline to determine what you're going to do. There is so much available information, and I just encourage everybody as an individual, a community, and of course, as a part of our great nation, to really inform yourself and then make the decision that is best for you and your family. And so with that, Dr. Slawi, I think we'll take questions.
Have questions?
Thank you, operator. We can open it up for questions now. And a friendly reminder to our media friends that when asking a question, please state your name and publication. And please keep your questions as short as possible so we can get to as many questions as we can in the time that we have. I'll turn it over to you now, operator.
Thank you. We will now begin the question and answer session. If you would like to ask a question, please press *1. Please unmute your phone and record your first and last name as well as your organization clearly when prompted. To withdraw your question, you may press *2. Once again, at this time, if you would like to ask a question, please press *1. And our first question is from Meg Terrell. If you wouldn't mind stating your organization, your line is open.
Thank you. It's Meg Terrell with CNBC. Dr. Slawi, I was wondering if you could just sort of go back through those allocation numbers per month that you laid out. I wanted to make sure we got it right. The 40 million doses December, 60 million January, 100 million in February. Is that just Pfizer and Moderna's vaccines? And then to follow up on something General Perno was saying, with only half the doses being sent out and then the second half being followed up to ensure proper storage, what is the right way for us to talk about the number of people who will get their first shot with these doses? In the first 6.4 million, is that 6.4 million people getting their first shot? We often divide by 2 and say it's enough for 3.2 million people. So what is the right terminology for us to be using?
Thank you, Meg, for the question. So the numbers were indeed, and I used the number of people to be vaccinated with the complete dose of vaccine, so 2 shots. 20 million in December, 30 million in January, 50 million in February, and that's with the Pfizer and Moderna vaccine. There is a chance that we may have more vaccine doses available in February, particularly with the Janssen's vaccine, if the Janssen vaccine gets an emergency use authorization approved. So as I said, it's possible, depending on the number of cases accruing, that phase 3 trial completes its efficacy endpoint during the month of January. So there may be a scenario where we could have a little bit more with a one-shot vaccine. With that vaccine, 1 dose equal 1 person immunized. My recommendation is to use a number of people immunized. I think it's more factual. I mean, more real to people.
Our next question is from John Collins with Science Magazine. Your line is open.
Hi, this is Science. You praised, Dr. Slawi and Secretary Azar praised the decision by the HRA to Pfizer, but the EMA in Europe and many European leaders have severely criticized it as being hasty, and our own FDA process obviously is transparent and slower, meant to build confidence. I wonder whether you want to clarify something that others are heavily criticizing in Europe.
But we don't know exactly how the process has taken place. As you know, we stay totally away from the regulatory process, whether with the FDA or with others. What we understand is that there have been rolling submissions where different parts of the file to be authorized have been submitted at different time points. I would speculate that Pfizer manufacturing CMC part of the file must have been filed quite a while ago, and therefore potentially the review has focused on the clinical side, the rest of it having been done earlier. But frankly, I cannot comment. What I would agree with you completely is we know the FDA process. It's a completely transparent process with independent experts commenting and asking questions and recommending or advising the agency. and we will imminently be going through it. I know personally from my experience in my previous life that the MHRA is an extremely high-grade agency. In fact, within the EMA, before they left it, they were certainly the scientific engine, the UK and the PI, the German part of the agency. Thank you.
Our next question is from Zachary Brennan. Please state your organization if you may. Your line is open.
Thanks for taking my question, Zach from Politico. So General Perna mentioned earlier that about 21 jurisdictions still haven't signed on to these data user agreements. What's going to happen with those jurisdictions if they ultimately don't sign on to those? And then can you talk a little bit about why certain states are saying the vaccine allocations are a lot smaller than what they originally had thought?
So, yes. So first question, we're down to 17. We are really getting to the last dot the I, cross the T, and I feel very confident that all the jurisdictions will have their data use agreements in, and everything will be all right. To your second question, what we're doing is instead of waiting until the end of December, where we know we'll have a cumulative amount of vaccine, as Dr. Slaoui mentioned, and I reinforced that 40 million doses, what we're doing is at the time of we speculate EUA is going to occur, the doses that'll be available is 6.4 million for Pfizer and 12.5 for Moderna. And that's what we did the initial allocation based on. And so that push will go out based on those allocations. But every day that goes by after the initial push, additional vaccines come off the shelf because they've been certified and approved for distribution and administration. Hence, what I talked about, the continuous cadence of delivery of vaccine going out to the American people. So it's not a one and done. It's a initial push and then a continuous cadenced flow of vaccine for planning and coordination and execution. Thank you.
Our next question is from Stephanie Ebbs with ABC News. Your line is open.
Thank you, Stephanie Ebbs from ABC. I wanted to follow up on that, General Perna. When you're talking about the continued cadence of deliveries, how will the amount in those deliveries be allocated? And is it correct to say that then each subsequent delivery would be followed by a delivery of the same amount, 21 or 23 days later?
So what we're doing is through Tiberius, the program that we established, which is located at each of the jurisdictions, we're establishing the available doses of vaccine to each state. And so they get to see that. The Tiberius allows them to see the allocation, allows them to go through a planning process of where they would like to have the vaccine to go to, manipulate it so that they can see, impact of the doses going to those locations. And then once it's finally approved, they hit send, and that is how we distribute. So quick answer to your question is through Tiberius, open and transparent with each jurisdiction as allocations become available. And then the second part of your question, I apologize, I don't remember it. Does anybody help me on that one? I can't remember.
It was the allocation in the states. How will you allocate those to each state?
Yeah, so per rata.
Yeah.
Oh, I apologize. Thank you. So the second part of the question is are we going to hold the second dose for every distribution as we go forward in the cadence? And the answer is yes. Our responsibility is to make sure that we have both doses in hand before we send the first dose out. That way, we're always confident that the second dose will be available for everybody as they get administered their shots. Over. Thank you. Over.
Next question.
Our next question is from Steve Housen with BioCentury. Your line is open.
I wanted to ask if there are any systems in place for tracking outcomes
for people who are vaccinated? Are there any registries or other systems for determining what the outcomes are on an ongoing basis?
Yes, so the FDA and the CDC are working very closely together to put together a very active pharmacovigilance and surveillance system using various very large databases currently in use.